3 days from now, you could be sitting in an emergency room wondering why nobody warned you about the symptom you ignored this morning. The frightening part is that it probably wasn't chest pain. It probably wasn't a dramatic collapse. It wasn't the kind of symptom you see in movies. In fact, it was likely something so small, so ordinary, that you dismissed it before breakfast. Every day across America, thousands of adults over 65 experience warning signs that appear during the first hour after waking up. Most never realize those symptoms were trying to tell them something important. Some end up suffering a stroke. Others develop heart failure. Some experience a life-changing medical emergency that could have been prevented if they had recognized the warning in time. I'm Dr. David. For more than 2 decades, I have worked with older adults in hospitals, clinics, rehabilitation centers, and emergency departments. I have sat beside patients who wished they had paid attention sooner. I have spoken with families who said the exact same thing. There were signs. We just didn't know what they meant. That's why today's video may be one of the most important videos you watch this year. We're going to discuss 5 morning warning signs that many adults mistake for normal aging but that can actually signal serious problems involving the heart, brain, blood vessels, and circulation. And please stay until the end because the number 1 warning sign is responsible for sending thousands of seniors to emergency rooms every year, yet most people ignore it completely. Before we begin, if you're committed to staying healthy, independent, and mentally sharp as you age, subscribe to the channel and turn on notifications. Every week, we share evidence-based health information specifically designed for adults over 60 and their families. Also, tell me your age and where you're watching from in the comments below. I read as many comments as possible and it helps build a community of people who are taking control of their health. Now let's begin. Last year, I treated a 72-year-old gentleman named Robert. Every morning he woke up with a mild headache. Nothing severe. No emergency. No unbearable pain. Just a headache. His wife urged him to mention it to his doctor, but Robert brushed it off. 6 weeks later, he suffered a major stroke. Looking back, that morning headache had been one of the earliest clues that something was happening inside his body. Which brings us to warning sign number 5. A headache that is already present the moment you open your eyes deserves attention. Most headaches that develop later in the day are often related to stress, dehydration, tension, or fatigue. But a headache that greets you before your feet touch the floor can be very different. During sleep, blood pressure naturally changes. In some older adults, blood pressure rises dramatically in the early morning hours. Sleep apnea can reduce oxygen levels throughout the night. Certain neurological conditions can also create pressure changes that become noticeable immediately upon waking. The result is a morning headache that many people dismiss because it eventually fades. The problem is that the headache is not the disease. It is the signal. Think of it like a warning light on your dashboard. The light itself isn't the problem. It's telling you there may be a problem under the hood. If you experience morning headaches 3 or more times per week, begin tracking them. Write down when they occur, how long they last, and whether they are becoming more frequent. Patterns often reveal problems long before a major medical event occurs. Now symptom number 4 is even more common, and millions of seniors experience it every week. Yet very few understand what it may be telling them. Imagine standing up from bed and suddenly feeling lightheaded. The room doesn't spin dramatically, but something feels off. You pause for a moment. Maybe you grab the edge of a chair. A few seconds later, you're fine. Most people assume this is normal aging. Sometimes it is, but not always. What concerns doctors is dizziness that lasts longer than 60 seconds. When that happens, it may indicate that your cardiovascular system is struggling to maintain adequate blood flow to the brain. Your brain depends on a continuous supply of oxygen-rich blood. If blood pressure regulation becomes impaired, even briefly, symptoms appear almost immediately. Some older adults experience this because of dehydration. Others because of heart problems. Others because medications affect blood pressure regulation. The danger isn't simply feeling dizzy. The danger is what that dizziness may represent. Studies have linked persistent postural dizziness with increased risks of falls, cardiovascular disease, and future heart complications. Tomorrow morning, Try a simple test. Stand up slowly and remain still for 90 seconds. Pay attention to how you feel. If dizziness continues beyond 1 minute and occurs repeatedly during the week, it's worth discussing with your healthcare provider. Now here's where things become even more important because symptom number 3 affects the organ most people fear losing as they age, the brain. Many adults over 65 tell me the same thing. They wake up feeling mentally slow. They struggle to find words. They forget why they walked into a room. They need extra time to organize their thoughts. Occasionally, this is normal. But when severe brain fog lasts 30 minutes or more, it deserves attention. Your brain consumes enormous amounts of oxygen and energy. When sleep quality declines, oxygen delivery falls, or blood vessels become damaged, cognitive performance often suffers first. That's why persistent morning brain fog can sometimes serve as an early indicator of sleep apnea, circulation problems, small vessel disease, or other neurological changes. One patient told me she felt as though someone had wrapped her brain in a thick blanket every morning. She assumed it was simply getting older. Eventually, testing revealed severe sleep apnea that had been silently depriving her brain of oxygen night after night. After treatment, her morning mental clarity improved dramatically. That's why I encourage older adults to monitor how long it takes to feel fully alert each morning. 5 minutes is one thing. 45 minutes is another story entirely. And now we're approaching the 2 warning signs that emergency room physicians hear about most often after a serious medical crisis. These are the symptoms patients almost always remember having before their stroke, before their hospitalization, or before their heart failure diagnosis. Yet they ignored them because they seemed too ordinary to matter. Before we continue, take a moment to ask yourself a simple question. Have you experienced any of the symptoms we've discussed so far during the past month? A morning headache, persistent dizziness, brain fog that takes too long to clear. If the answer is yes, leave a comment below with the word yes. You may be surprised how many other people share the same experience. And if you're finding this information valuable, please click the like button. It helps this video reach more older adults who may need this information before it's too late. Now let's discuss the 2 warning signs that concern doctors the most. Warning sign number 2 is unusual morning fatigue. This is not ordinary tiredness. This is not staying up too late watching television. This is not feeling sleepy because you didn't get enough rest. This is something entirely different. Patients often describe it as feeling unusually heavy. They wake up exhausted despite sleeping through the night. Their arms feel heavy. Their legs feel heavy. Even simple tasks seem harder than they should be. One woman told me it felt like she was walking through waist-deep water from the moment she got out of bed. Another patient said it felt as if someone had quietly drained his battery overnight. The reason this symptom is so important is because older adults often experience serious cardiovascular problems differently than younger people. Instead of chest pain, they may experience overwhelming fatigue. Instead of dramatic symptoms, they may simply feel that something isn't right. In many cases, the heart is working harder than normal to circulate blood throughout the body. In other cases, anemia, thyroid disorders, poor circulation, or metabolic problems may be contributing to the exhaustion. One of the most dangerous mistakes older adults make is assuming fatigue is automatically part of aging. Aging itself should not make you feel completely drained every morning. If your energy level suddenly changes and remains lower than normal for several days, don't ignore it. Pay attention. Your body may be trying to warn you long before a major event occurs. Which brings us to the number 1 warning sign. The symptom that emergency physicians repeatedly hear about after a stroke. The symptom that patients almost always remember experiencing. The symptom that many people ignore because it disappears. Temporary vision changes. Perhaps you wake up and notice part of your vision seems blurry. Maybe a gray shadow appears. Maybe one eye suddenly seems dimmer than the other. Perhaps a dark spot blocks part of your view for a few moments. Then, just as quickly as it appeared, everything returns to normal. Most people feel relieved when this happens. They assume the danger has passed. In reality, the opposite may be true. Temporary vision loss can occur when blood flow to the eye or brain is briefly interrupted. Sometimes a tiny clot forms, blocks circulation for a short period of time, and then moves away. The symptom disappears. The underlying danger does not. Doctors often refer to these episodes as warning events because they may occur days or weeks before a major stroke. One of my patients, a 68-year-old grandmother named Helen, noticed a foggy gray patch covering part of her vision while making breakfast. It lasted less than 3 minutes. By the time she considered calling someone, her vision was normal again. Fortunately, her daughter insisted she go to the emergency room. Testing revealed a severely narrowed artery supplying blood to her brain. Treatment was started immediately. Months later, Helen remained healthy and independent. Had she ignored the symptom, the outcome might have been very different. This is why any sudden vision change should be treated as a medical emergency. Even if it lasts only a few minutes. Even if it completely disappears. Even if you feel perfectly normal afterward. Now that we've discussed all 5 warning signs, let's talk about what you should actually do if you notice one of them. Knowledge without action doesn't protect anyone. Action does. That's why I recommend what I call the morning health framework. Rule number 1. Keep a symptom journal. Starting tomorrow morning, place a notebook beside your bed. For the next 30 days, record any unusual symptom that occurs within 90 minutes of waking. Write down the date. Write down the symptom. Record how long it lasted. Note whether it resolved completely. Doctors often make better decisions when they can see patterns instead of isolated events. Rule number 2. Use the green, yellow, red system. Green symptoms are mild, familiar, and resolve quickly. Continue monitoring them. Yellow symptoms are recurring, unusual, or beginning to interfere with daily activities. Schedule a medical appointment within the next week. Red symptoms include sudden vision changes, facial drooping, weakness on one side of the body, severe headaches, speech difficulties, chest pain, or sudden confusion. These require immediate emergency evaluation. Do not wait. Do not drive yourself. Seek emergency medical care immediately. Rule number 3. Monitor your morning blood pressure. Check your blood pressure within 10 minutes of waking, before coffee, before breakfast, and before taking medications whenever possible. 1 reading means very little. 30 readings reveal trends. Trends help identify hidden problems that may not appear during a routine office visit. Rule number 4. Ask better questions during your next doctor's appointment. Ask whether your symptoms could be related to sleep apnea. Ask whether additional cardiovascular testing is appropriate. Ask what specific warning signs should send you directly to the emergency room. The better informed you are, the faster you can respond when something changes. If there's one message I hope you remember from today's video, it's this: your body rarely fails without warning. More often, it whispers before it screams. The challenge is learning how to listen. A morning headache, persistent dizziness, brain fog, unusual fatigue, temporary vision changes. These symptoms may seem small. They may seem harmless. But sometimes they are the first clues that your heart, brain, or circulation needs attention. Growing older doesn't mean living in fear. It means becoming more observant, more proactive, more informed. Because the earlier a problem is identified, the greater the opportunity to prevent a crisis. Now I have a question for you. Which of the 5 warning signs surprised you the most? Was it the morning headache? The dizziness? The brain fog? The fatigue? Or the temporary vision changes? Let me know in the comments below. I read every comment, and your experience may help someone else recognize an important warning sign. If you found this video helpful, please subscribe to the channel, turn on notifications, and share this video with at least one person over the age of 65. That single share could provide information that changes a life. Thank you for watching. Take care of your heart. Take care of your brain. Stay informed, stay proactive, and I'll see you in the next video.